the request to access commodities and supplies as well. So the public sector program started to supply test kits to the private providers and drugs to the private providers to cater for this group of Kenyans who were coming in and were having difficulty meeting even the lowered cost of treatment in the private sector. The role of the public sector became more critical in expanding the reach of this network in the private sector. The injection of these commodities and resources from the public sector program was very essential in sustaining the growth and expansion of the network. Up to this point, I believe that we have built the bridges between the public provider, public program, and the private sector providers. And it has been very, very essential to maintaining the operations and ensuring the continuity of service delivery in the network. And we see this private-public partnership model as the way forward in implementing this sort of social franchise to reach more and more Kenyans. We demonstrated practically that the policy of public-private partnership can be implemented in the health sector. We basically developed a model that was responding to the needs that we were identifying in the marketplace, in society. And we continued to develop the model without precedent hitherto. But later on, the government actually came up with a policy framework for public-private partnerships. Through constant engagement and building of relationships and dialogue, being accountable, we have been able to allay some of these concerns and demonstrate through the effect of reaching more and more Kenyans who needed this healthcare service that it could actually work even for a long-term disease condition like HIV. And so going into the future, we really hope to see more public-private partnership initiatives in the health sector. The importance of the public-private partnership cannot be overemphasized. There is just not enough money to be given by government, either at the national level or the county level, to offer the required quality of care to all Kenyans in need. And so the role of the public sector, the private sector, is going to grow with time. Models such as this one provide an alternative avenue for those who either have a cover for their health care or are able to afford subsidized care to access the required interventions they need for their health care. The number of public facilities are also not expanding. They are not increasing commensurate to the need. So it's a common story that you go to public facilities and there are issues about quality, there's many issues about access, there are many issues about infrastructure. I do not see that these issues are going to be solved anytime soon. private sector is going actually to continue to grow, so that the options available to Kenyans to access quality care also expands to meet the growing need for health. Lastly, we continue to see a growing burden of disease conditions, not only the traditional communicable diseases. We are now having even a greater burden of non-communicable diseases. So we have a twin burden of huge public health concerns that clearly are going to overwhelm our existing public health care system. Where and what are the options to enable Kenyans to access the care they need, they can afford when they need it? These public-private partnership models, the social franchise, and the role of the private sector is going to be even more critical going into the future. And I see a bright future for the social franchise movement in the service delivery sector. I see a growing health sector, private health sector, and I see Kenyans as the economy grows and our population continues to grow. I see Kenyans having broadened options to access healthcare services. So I see the Gold Star Network as one of these mechanisms that will offer options to Kenyans to access required care, especially since we have already demonstrated that in partnership with the public sector, we can manage long-term conditions and offer them to the required quality as determined by our own national guidelines and standards.